If you know of a friend or family member who is dealing with a substance abuse disorder, then you know how challenging and difficult this is for everyone to navigate. So here to give us some insight and a path forward are Alan Davidson from Central Florida Behavioral Health Network and Marvin Coleman from Operation PAR. Welcome, gentlemen. Thank you for being here.
Oh, thanks for having us.
This is such an important topic.
It is.
It affects so many people. And I'm going to start with you, Alan, if you can kind of share your mission and connect the dots between managing entity and Operation PAR.
Sure. So Central Florida Behavioral Health Network, we're a managing entity. We're one of 7 managing entities in the state. We're the largest in population, the second largest in landmass. So we are the funder, the safety net system of care for providers like Operation PAR and Marvin Coleman here. So we fund from Pasco County down to Collier, over into Hendry Glades, and up into Polk, Highlands, and Hardy. We cover or fund quite a bit of services like crisis care, detox, outpatient, mobile response teams. And again, one of the providers that we fund is Operation PAR and Marvin Coleman.
Marvin, tell us about Operation PAR, because now we're getting into how people receive treatment, how people receive help.
Absolutely, absolutely. Well, we're going on our 55th year serving the community, actually. It started with a mom who came home from work one day, found that her daughter was under the influence of something and couldn't figure out what it was or find the help. So she started a program which has basically expanded to about 7 counties here in West Central Florida. That includes things from intervention, prevention, detoxification treatment, inpatient and outpatient services.
Now, Marvin, there are a variety of impacts that this can have, that opioid abuse can have on folks. Sometimes you see the signs, you know it's happening, but sometimes it's a little bit more discreet. You don't realize that someone may be battling an addiction issue. What kinds of signs should we look for?
Absolutely. Well, for one, I want to mention the fact that a lot of times the access to it comes through prescription medication, something that they legitimately had either an injury or something take place where they started using medication and then became addicted to that particular medication. And so the signs and symptoms would be things like, if they're on a medication, that medication being utilized a lot quicker than what it should be. The other signs and symptoms would be, because of the fact that it is something that helps an individual deal with pain, is if you see them lethargically starting to kind of slow down, since the opioid is a depressant. And so those are things that you're going to look for. And then just the behavioral changes in their normal patterns, missing work, missing family obligations, different things like that are going to be signs and symptoms that a person who may either be on prescription drugs or who has had a history of some level of substance use disorder may be actually experiencing some use at that particular point.
And a follow-up for you, Marvin, what are we seeing as far as trends go? We know this is a pervasive issue. I mean, for our country, for our community, what are we seeing more usage of?
Well, the things that have really been identified as fentanyl currently right now, it is still a very big issue because it is the largest proponent of overdose, and overdose has been a really big thing that we have focused on, is trying to minimize overdose based on fentanyl and other prescription drug use or other opioid use. And so the trends are looking good. Over the last year, we've seen decreases in the overdoses in that regard, but still way too many to really look at as being viable for people getting help.
Absolutely. And Alan, what about getting recovery? What about getting help? What are your vision? What's your vision?
So we want access and engagement for every person here in the Suncoast area. And with providers like Operation PAR, we have a lot of other providers who offer that and have that open door, and just really honored to work with a provider like Operation PAR who's, like Marvin said, been around forever. They're just kind of an anchor in Pinellas County and other places here in our area, but really the kind of the mothership, if you will, is in Pinellas County. So just honored to work with Operation PAR.
And Marvin, you've seen success stories. I think that's the most frustrating thing. Someone sees a family member or friend going through this, or you're that person and you don't see a way out. You don't see light at the end of the tunnel, but you're seeing that.
Absolutely. There is definitely help out there for individuals who are really seeking help. And that doesn't have to be the individual who's experiencing it themselves, but the family member, because we're all kind of involved at that particular point. And one success story I'm thinking of in particular is a young lady who basically was homeless and on the streets due to the fact of her addiction to fentanyl. But once she accessed services through our medically assisted patient service program, not only was she able to get into treatment and get the help she needed, but she was also able to get her children back and reunite the family, which gave her a greater catalyst to continue in that recovery and in help. So there is help available, and there's effective research-based help available out there if people just are willing to take a look and make those steps.
Right, right. If you have breath in you, there's a chance to turn your life around.
Absolutely.
And if you want to find out more, where can here we go, hopeforsuncoast.org, operationpar.org, and addiction is a struggle for so many, but there's hope. So you can find it. Thank you so much.
No, thank you.
Alan and Marvin.
Yep, thank you.
Thank you very much.